What I have here is a level 3 lymph node dissection, and the first thing that I like to do is palpate it to see if I can feel any tiny lymph nodes that I can just snip off, because I don't want to accidentally cut through them and then miss them. Obviously you can see that there's a nice big juicy one right there. There's a lymph node here that's hanging off. I can feel one here. So I'll cut this one off. I would rather get as many of them intact as possible first that I can, so I don't accidentally have to trisect or quadrisect them. There's another little one. Now this one, the larger one, I'm going to cut away and also put to the side. When I'm cutting them, I like to use my finger here and kind of push on the adipose tissue. Then you can kind of feel for where the lymph node ends, and I take my knife and I can kind of push and cut at the same time, and then that way I still have the capsule here and I still have some adipose tissue. You don't want to take off all of the capsule, because one of the staging factors is if the cancer goes through the capsule of the lymph node. There's a few smaller lymph nodes on the outer surface of the adipose tissue of the larger one. I'm going to cut those away. One thing I like about neck dissections is that there's a lot of lymph nodes, and there's some sort of satisfaction in finding a whole bunch of lymph nodes in such a small area, I think anyway. So here's another lymph node that's right next to the bigger lymph node, and I kind of like to pinch and maybe use my nail, if I have nails that day, and get that plane that's in between them. Now if this little node was matted to the bigger node, it wouldn't be able to move away from that. Okay, so I have this guy pretty much sectioned off, so I'm going to put him to the side. I'm going to feel around for any other lymph nodes that I can see or feel. A lot of neck lymph nodes are going to be a maroon to pink. Okay, so my strategy is I cut and then I kind of fan out, because lymph nodes in the neck can be very tiny. See, here's one here. Move this guy out of the way. And then after I kind of fan it out, I'll still feel for the little ones. You'd be surprised at how many tiny lymph nodes you can find in these neck dissections. And then I might go over it again and then actually cut through it. But again, it's almost like kind of filleting a fish. You kind of insert your blade and then just kind of push it along. Because again, I'm trying to get these little lymph nodes whole instead of having to bisect them and have two little pieces of lymph node in one cassette. Okay, here I can see one here. They kind of bulge out. So I'll take that and cut that away. And then I just continue this process all the way to the end. Now, if this dissection had vein or muscle, you want to make sure to submit a section of that So we want to see if the tumor has metastasized to those structures. The surgeons will try to leave the muscle and the vein if they can. Okay, I don't see or feel anymore. I think that's it. Nope. Okay, there's a tiny little one right there. Snip that guy off. I always like to go through a second time, especially with neck dissections, because you might miss little tiny ones that might be there. And then here's a tiny, tiny one right here. I don't know if you could see it. Okay, so that looks pretty good. Now for this guy, usually because they're so big, they're grossly positive. I'll cut this guy. Yep, and sure enough, you can see it's gray, white, and fibrotic, and then it has those areas of necrosis. It looks a lot like the original tumor. Since it's not too big, it's under 3 centimeters, I'm going to submit this entire lymph node. If you were to have a lymph node that's over 5 centimeters, talk to the pathologist. Some of them will want all of it, some of them won't. Some of them just want the capsule to see if there's invasion into it. All right, thank you.